In this project, we choose the healthcare profession of cardiologist as our study. A cardiologist is a doctor who specializes in treating disease of the cardiovascular system, mainly the heart and blood vessels. Cardiologists are specialists who focus on cardiology and are responsible for treating various heart diseases such as arteriosclerosis, acute coronary syndromes, and more. When we look at the map here, Perlis recorded 0 cardiologists while Kuala Lumpur recorded the highest number of cardiologists. This indicates that cardiologists have a high number of 4 areas with high population density such as Kuala Lumpur and Selangor. In East Malaysia, Sabah and Sarawak have a total of 8 cardiologists and 18 respectively. Sarawak recorded the higher number of cardiologists than Sabah. According to the Department of Statistics Malaysia, the total population of Malaysia in 2019 is 32,520,000 people. In 2019, Malaysia has recorded a density of cardiologists of 9.38 per million population. The highest density of cardiologists is still focused on Kuala Lumpur, with a record of 48.31 per million population. Penang recorded the second highest with a density of 22.6 per million population, followed by Malacca with a density of 13.98 per million population. Then, we compare the percentage and number of cardiologists in the public sector and private sector for a period of 5 years. The number of cardiologists in Malaysia has recorded a good increase every year. If we compare 2020 and 2019, a total of 190 cardiologists were successfully registered. In 2019, a total of 305 cardiologists were recorded. It is the highest cardiologist recorded between 5 years. On average, about 70.7% of cardiologists are placed in the public sector, while 82.3% are placed in the private sector. Each year, we will see an increase of 30 cardiologists on average. Based on the chart here, we will able to see the percentage of cardiologists in the public sector and private sector. For the public sector, the chart shows the total percentage of inconsistent cardiologists for a period of 5 years. For the private sector, the total percentage is also inconsistent and has increased and decreased each year. Thus, we can see that cardiologists has a higher percentage in the private sector than in the public sector for the past 5 years.
Now I will explain about evaluate workforce destiny. Currently in Malaysia, we have 305 cardiologists, 250 in private sector and 55 in public sector, which is 82% goes to private and 80% goes to the public sector. Based on statistics, it seems like Malaysia has enough cardiologists, but it's never enough. The amount of cardiologists in Malaysia is too little. In our opinion, we need at least 1,000 cardiologists in Malaysia. With this amount of cardiologists, we can reduce waiting times. For private sector, this might not bring any problem because of the large amount. However, we still need to bring more cardiologists. It is because not all private hospital has a cardiologist. If a patient really need to be checked, this will take time to transfer that patient to other private hospital that have cardiologists for their one of the specialists. In this case, Malaysia still needs to add some more cardiologists to private sectors. Now we move to the main problem, that is public sectors. For government hospital in Malaysia, they really lack of cardiologists. With only 55 cardiologists, this really become a big problem when it comes to patients that can afford private hospital. The amount is too little. This will increase waiting time for government hospital. Some patients might not be able to meet the cardiologist because of the lack of cardiologists and need to wait for a long time. Only government hospital that near big cities have available cardiologists. Most hospital at the countryside does not have a cardiologist. In this case, if the patient really need to be checked, it will take more time to transfer the patient to near town that provide cardiologists. The patient might not survive within time to send them to other hospitals that have cardiologists. The amount of patients is more than cardiologists that Malaysia has. Malaysia need at least 1,000 cardiologists and need to have more and more year by year. From a different angle, the suitable number the need for cardiology department to promote population health, taking into account the incidence of cardiovascular disease and healthcare policy goals, and the definition of professional obligation for cardiologists. Although it may seem counterintuitive, a few studies show that when the healthcare system is successful in reducing cardiovascular mortality, demand for cardiologists tends to rise. This is caused by the need for more cardiologists to be actively practicing, as well as the fact that someone who has myocardial infarction becomes a patient for the rest of their life. Invasive operations like cardiac catheterization and angioplasty may be more common in areas or nations with a higher concentration of cardiologists, according to some data. The result of medical treatment could also be enhanced by having more cardiologists. When receiving treatment for an acute myocardial infarction, patients treated by cardiologists experience lower in-hospital mortality than patients treated by doctors from other specialties, and patients admitted to hospital with cardiology department fare better than patients admitted to hospital without such department. Cardiologists, as opposed to doctors from other specialties, provide patients with heart failure who are in the hospital with better evidence-based therapy and better.
If you look at the number of cardiologists in Malaysia, broken down by state, we can see that they are not spread out evenly across the different states. In terms of the number of cardiologists, it is clear that there is a big difference between the three states. Even though Pahang, Sarawak and Sabah are some of the largest states in Malaysia, there are only 7, 18 and 8 cardiologists in each of them. Statistics shows that Malaysia states with the most people like Selangor, Sabah, Johor and Wilayah Persekutuan Labuan need more cardiologists because the number of people tend to go up at the same rate as the number of people who get cardiovascular disease. Muhammad Yusuf Mahidin, Malaysia's chief statistician, says that cardiovascular disease has been the leading cause of death in the country for the last 20 years. This means that there should be enough cardiologists all over the state. Last but not least, there are only 250,000 people living in Malaysia's state of Perlis in 2019, which is the lowest population in total. This means that the state has a small number of cardiologists, but that doesn't mean that there won't be any cardiologists around. With 10 to 15 cardiologists, cardiovascular disease can be treated.
How did we achieve an optimal workforce density and a balanced distribution across all states in Malaysia? To achieve an ideal number, cardiologist workforce density and balanced distribution in Malaysia, first of all, the number of the medical students enrolled in the cardiology courses should be reduced. This might help to reduce the line of the medical students waiting to intern at the hospital, which could directly assist medical students keep their medical knowledge, because waiting too long could slowly erode their medical ability. Also, having a number of the medical students as an intern may result in higher quality cardiologists produced in future due to the more incentive monitoring of those intern students by the cardiologists in charge. Second, by shortening the time taken to be cardiologist. For your information, time taken to be a cardiologist currently up to 15 years and more, but lowering the time required to become a cardiologist. The qualification to become a cardiologist must also be enhanced. This might result in more high quality cardiologists being developed, and also degree doctors might have interest to become cardiologists as the time taken has been shortened, which lead to more increased cardiologists to be produced. Next is increasing the number of the cardiologists in public hospital, which may contribute in reaching the optimum workforce density. The shortage of the cardiologists in public healthcare will result in increased work pressure, which will contribute to resignation. In this case, government could raise cardiologist quotas in the public sector by having a standard or better income than the private sector, which might enable more cardiologists employable in public sector and indirectly minimize cardiologist resignation in Malaysia. Overall, the government do not have enough cardiologists and they are not well trained. Despite having a surplus of medical graduates, it takes too long to train cardiologists, and when they do, the older ones also depart as there will be a big gap of time.